As it is rightly said, vision is the art of seeing things invisible. There is a couple in Thane, Mr. and Mrs. Wavikar, who saw one dream and they went ahead to achieve this unbelievable and unimaginable dream for Thanekars, which has benefited lots and lots of people all around Thane and Mumbai. Let's unfold the journey of Wavikar Institute from the Executive Director of Wavikar Institute, Mrs. Vaishali Wavikar. Welcome, Vaishali Wavikar. Thane and Wavikar Institute now have become very synonymous. First of all, I would like to ask you that why did you feel like starting a institute and not a hospital?
See, 25 years before, when we started this hospital, there were hardly any big setups, to treat the complex eye diseases in and around Thane. So Dr. Wavikar always had this in his mind. He has to start something with comprehensive eye care so that all the people are benefited and they don't have to travel all the way to Mumbai or to South India for the complex eye disease treatment. And we wanted to start all the newer modalities. So we started humbly in a very small setup, but this goal was always there at the back of our mind. Second thing, the rural Thane, like unapproachable part of this, the part which is, not reachable. So those distances we wanted to cover and we wanted to treat those patients also. So that thing was there on our mind somewhere, ki this needs attention. So the charitable wing was in making that time only. Third thing, Dr. Wavikar is he has got passion for excellence and quality. With his experience and his expertise, he wanted to spread the knowledge through his teaching. So this is how this educational angle came in. So we wanted it to become an institute always and not only a hospital where we treat the patients. We treat the patient at the same time we are kind of sharing our knowledge and expertise with a lot of other upcoming professionals so that they are also benefited and the good eye care standards are set up.
Wavikar Institute is the biggest eye hospital in Western India and it is one of the very popular hospitals in Thane also. So how is your hospital different from other hospitals? Can you elaborate?
There are too many points to tell you how to differentiate our setup, our brand from other eye hospitals. I am very proud to elaborate those points. First and foremost is the hospital is spread over 35,000 square feet and it has got the ambience of international standards. Not only that, we have 7 ultra clean theatres, operation theatres. This itself is a big thing, I suppose, because this is not the hospital which is built on corporate funds. This hospital is built by only 2 individuals, Mr. and Mrs. Wavikar. Maybe in the medical history, this is something which is very unique in itself. The second point is we always harp on the latest technology. We try and hire the best machines and we try and hire the best human talent. We have got the doctors from reputed organizations all over India and abroad. Third important point, we have been pioneers in bringing the technology to Thane city, barring a few, including the first laser cataract surgery in Asia. Dr. Wavikar is the first cataract surgeon who has performed laser cataract surgery in Asia. We give importance to overall experience of the patient. Like we take care of the patient and staff interactions. Then we pay a lot of attention on waiting time. Then administrative assistance is given to the patients and also the clinical management. And all these points we try and improve continually. So this is what I feel, makes us little different. People rely on us, not only the eye care, but the compassionate eye care which we give, which is always, involving a lot of human touch. We believe in conducive work culture, which is based on values and ethics. And that is where we want to create win-win situation for all of us, like the management, the staff, and the patient. At the end of the day, everybody should be happy and satisfied. So this is what our aim is. And as you can see, Wavikar Eye Institute, WEI. So it is always we say ki V stands before I. So we believe in teamwork. So that is the strongest point I think we have. We call it as Wavikar Eye experience, and we proudly say it's in our DNA. It's the best USP we have. Treating the patient holistically with human approach is our goal. Next point is we are amongst the first few eye hospitals in India to get NABH. We are NABH since almost 9 years. So following the stringent standards on quality and safety has become our routine. One more point to elaborate is we are serving all strata of society, right from the free cataract surgeries to the high-tech and maybe the costliest laser cataract surgery. We have it all. And one more thing we are special for is we are always giving a lot of importance to educational initiatives, like we are conducting a lot of fellowship programs, we are conducting master classes, we have our own college of optometry. So education has been a forte of this organization.
As you mentioned, Wavikar Institute is one of the few institutions or hospitals to get NABH certification in India. So how does this NABH actually help the patients?
See, NABH is based on global benchmarks, which are, ensuring the patient gets the quality and the excellence in any healthcare delivery system. So we are bound, NABH reassures that we are doing that, and it has got its stringent mechanisms to have regular checkups with that. So we have to maintain those stringent standards. That is the first thing. Second thing, NABH protects the rights of the patients as well as staff, and it has got the strong grievance redressal mechanisms. So the whole system is again thoroughly vigiled for. The third thing NABH does is scientific clinical care. And the fourth important point of NABH is it has regular mechanisms to have the monitoring of patient satisfaction. So these are the things by which it's like we have not left with any other options but to treat the patients well according to the standards, with taking care of quality and safety in our minds. So in a way, patient is benefited, and we are also learning new things, and we are also improvising daily. And we have to document everything, and we have to send it to them periodically. So it's like there's no escape. You have to do a good work.
Wavikar Institute is also into a lot of CSR, that is corporate social responsibility. We undertake many initiatives. Can you name few of such initiatives?
We have our charitable trust by the name of Indirabai Charitable Trust. We are running a regular OPD. Every day we have OPD in the afternoon, where we are getting walk-in patients all over the district actually. We are conducting various eye checkup camps in again a lot of rural areas, the remote rural areas, as well as the urban people who are underprivileged. We are conducting camps for them also. The eye camps are not only consisting of cataract camps, but they are various camps like eye donation awareness camps. Then we are giving a lot of importance to diabetic retinopathy. So we are making people aware of what is diabetes, how it is affecting retina. Also, we are doing fundus photo camps, by which the retina is screened, and you come to know about a lot of problems which are happening because of diabetes. Then we are conducting camps wherein we are distributing spectacles, as well as we are doing a lot of artificial eye, that is prosthesis, because a lot of people, the rural population, are having these problems. So we are doing a lot of other things besides only cataract camps. Plus, patients who are diagnosed with some other diseases, they are also brought here and they are treated accordingly. The medical as well as the surgical treatment is given to them. As I said, we have our Vishwanath Eye Bank, we are doing a lot of work in eye donation awareness. And this district needs to, even not only in Thane district, but I think all over Maharashtra, the awareness has to be, increased about eye donation. So that our part we are doing, whatever little bit we can do. Then our optometry college, a lot of people are coming from rural areas, like from Shahpur, from Wada, and we are very happy because one person who gets the job after optometry, the education completion is like his starting earning is around 18 to 20,000 rupees. So one person earns and the whole pada or whole area, their whole family and the people around are getting benefited. So this particular initiative, I wanted to reach across the Thane district, this optometry college. So this is also one kind of CSR we are doing. Last but not the least, we have our mobile eye clinic, that is a van in association with Lions Club. We are trying to reach the inaccessible areas, the remote areas of Thane district and other districts also, wherein we are trying to check the patients on site, because the van is having a lot of machinery inside. So we can check the patients, we can diagnose the patients, and we can do the needful. So that is something which is, again, it is first in and around Thane district.
It was indeed a pleasure to know your 2.5 decade journey of Wavikar Institute. We would like to know what are the future plans.
As far as possible, I can see, we are going to introduce something like a teleophthalmology unit so that we can benefit the patient from distance. The distance should not be a problem in treating the patients. This is what is going to be our theme as far as the teleophthalmology is concerned. We are working on it. It is going to take some time, but that is what our future plan is. We would like to develop this as a tertiary eye care center. It is already a tertiary eye care center, but there are certain modalities which we are not having. We will try and ROP treatments. Okay, so these kind of treatments we are trying to have. One more modality which we need to work on is ocular oncology. So in future, we will try our best to get these modalities right in Thane so patients don't have to travel far. We would like to give more attention and importance to our educational initiatives, thus creating good ophthalmic professionals like good optometrists, good ophthalmic assistants, good doctors around, good fellows around, so that we are in a position to spread a good epidemic of excellent eye care. So how today's millennials will pronounce it as we will go viral with good eye care. Thank you.